We are so glad you have joined us for another episode of Wide Open with Dr. Sylvia Atkinson. How are you today, Dr. Sylvia?
I'm just great, Ava. How about yourself?
Doing well, doing well. Anxious to hear what you have to talk about today.
Well, we're going to talk about the temporomandibular joint. And if anyone listening isn't exactly sure what that is, it's the joint that allows your jaw to open and close. Kind of like a hinge. The joints are at your ear or earlobe, about in that point. And if you open and close your mouth, you can feel them. If you put your fingers in your ears and press forward gently, you can feel it operating, if you will.
Well, I know, only from my teenage years, know a little bit about this because I always had really straight teeth, but there was something wrong with my joint there, and I ended up having braces for like 3.5 years
Did
to
you have pain?
realign. Did have pain and a lot of popping, a lot of noise. And they would lock at some points.
Well, those are some of the things that people report. The majority of us have clicking or popping noises related to opening and closing our mouths. It's when the symptoms become painful that we generally decide to treat. And those symptoms can range from pain in the joint area, headaches, severe and acute pain that limits the ability to open your mouth, and as you mentioned, locking open in some cases.
It just happened during a dental visit with me. And the jaw actually locked up, and I jumped from the pain. Otherwise, I don't know if they would have picked up on it all those years ago or not. But it just happened to be while I was in the chair that it did it. And like I said, I wore the braces, and it seems to have repaired the problem.
I think in some cases that braces can change the way the teeth come together and remedy problems if they are related to your occlusion or the way your teeth come together.
Mm-hmm.
That's certainly the case. A lot of the symptoms that I see and hear about are related to clenching and grinding, which we call bruxism. And people who routinely grind at night, and nobody knows, I grind my teeth at night. We can usually tell in the dental office because we can see wear facets on a person's teeth that tell us that they grind their teeth at night, whether they realize it or not. Also, bruxism or grinding and clenching is associated with sleep apnea, believe it or not. Now, I'd have to look a little farther into the nuances of that, but today I just wanted to talk about dysfunction of the temporomandibular joint. A patient reported to me within the last 2 days with intense pain on the right side. She'd been in a domestic abuse situation and had been hurt. So trauma is one factor that can lead to pain and symptoms in the joint. But a lot of times people who are under stress clench without realizing it and trigger these muscles to go into spasms. And the muscles can cause if they're held in that position for a long time, it can cause reception problems within the nervous tissue that supplies those areas and result in pain. The way I like to approach it in my practice at Jasper Dental Associates is in an acute situation. That's what we would call if somebody just has sudden pain and tremendous pain. We start with a steroid called Medrol Dosac and Flexeril, which is a muscle relaxer, to try to ease the symptoms and decrease the inflammation. Ibuprofen or nonsteroidal anti-inflammatory medications can be used as well. But in the end, the treatment will 9 times out of 10 require making it more difficult for a person to trigger these muscles. And that will be an appliance of some sort to wear at night or in some cases in the day. If a person's having acute symptoms, as my patient did this week, we instruct her to wear something we made for her quickly in the office all the time and allow the medication to work, let the muscles rest, and try to get resolution in that way. A mouth guard, we call them hard, soft mouth guards because on the outside the plastic is clear and hard. on the inside it's a little bit softer, can be worn at night and then as needed during the day. If a person drives and clenches when they drive, or exercises and find that they clench when they're exercising, they can always pull it out and use it in those times. It is something that you have with you at home, and it will prevent the teeth from locking together and triggering the muscle spasms that lead to the pain and inflammation in the first place.
You know, I do that a lot. I get stressed and I'll catch myself, I'll start hurting, my head will start hurting, and I'll realize, well, no wonder my entire face is tight as a drum, you know, and I've got my mouth clenched together and my eyes, you know, my brow curled up and all that stuff. So we can cause ourselves a lot of damage by stressing out.
Stress management is another component of treating a human being who's having these problems. Well, obviously, if a person's had a domestic abuse issue, well, not only is that an emotional or psychic stress, but she's had physical stresses as well. But if it is basically an emotional or psychological stress, then the mouth guards or appliances that we provide really help a person control the clenching and grinding that lead to the pain. Another thing that I'm doing lately in my practice is using Botox to help weaken the muscles that clench when you're in that position of clenching. And over time, if a person comes in and has an injection in these muscles 2 or 3 times over the course of a year, there will be some weakness involved with the muscles, and it can help reduce the amount of clenching and grinding that's happening.
You're really making me wonder about my headaches. And
Well, headaches are definitely another symptom of the same problem and can be relieved. We use both the mouth guard, and then I treat patients' muscles of mastication, or the ones in your cheek that really, when you clench together and touch them on either side, you can feel, as well as the forehead muscles, which has the added benefit of reducing wrinkles.
Well, that's always a bonus.
It's kind of nice, get out of pain.
But you're doing it for medicinal purposes,
Absolutely.
so you're good.
And there are other areas, depending upon the type of headache, that can be treated in terms of the muscles involved. So it's pretty interesting.
Now, the jaw clenching, and this may be something, no, we're not. Now, is it going to be responsible for more of the headaches that start around the temples and the side of the face, or can it be
generally they're going to be in the facial area? But it can be connected to those that are at the back of the neck, because if a person's really,
when I get stressed, I
exactly
clench hard. I mean, I'll realize my whole head is just like a big, a drawn up. Yeah, it's terrible.
And we do, going back to the braces, we do see people who've had a reduction of symptoms when in braces treatment. Those clenching habits are limited or changed.
Well, this does come back more. As I get older, it comes back more. It seems like as we have more stress in our lives. But I don't have the...
It's supposed to decrease.
Yeah, I know. I'm working on that. I don't have the popping anymore, not since they did that when I was a teenager. And there's not the pain directly in the jaw. Like I said, it's just more about headaches. And so, yeah, you're making me wonder if I'm not causing some of these myself by stressing out and going, "Arr."
And I was happy to hear... And within the last year, a friend of mine who had these acute symptoms was seen by a physician in our town, and the physician was wise and suggested the same thing that I do. She hasn't had that mouth guard made yet, but he treated her in the same way, which is nice to know that there are physicians out there who can get you to the right person for treatment. Because treating the symptoms initially with a muscle relaxer or the Medrol dose pack, which is a steroid or anti-inflammatory medications, will only sometimes put a Band-Aid on a problem that can come back. That's why I like the use of appliances in therapy for this too.
Which I guess the appliances make it where they can't put that much.
Correct. And in an acute situation, as I had this week, the appliance that we made fits over the front teeth. And so you're really only touching with your very bottom or top front teeth, and everything else is unable to connect in the back. So that provides immediate relief from being able to clench or grind. It feels a little weird at first, but having worn one myself years ago when I had these kind of problems, it does give you relief pretty quickly.
Well, I'm figuring I probably need to just come see you.
Come on in.
That is, it's awesome information, and you always provide us with such awesome information. And this is, what you do is more than just dental health. It's really overall health, because your dental health affects that.
We very much try to
so
look
many
at the
ways.
entire human being. And
Right.
yes, there are some things we can see before a physician might see that is a systemic problem that a person has, whether it's an immune system issue that would lead to candidiasis or thrush, or a yeast infection in the mouth, or Sjogren's syndrome, which I posted today on the Facebook page. April apparently is Sjogren's Awareness Month, and Sjogren's syndrome is reflected in dry mouth, dry eyes, difficulty swallowing, and it is an immune system problem or syndrome that we will often see in the dental office, because dry mouth is a problem that then can create all kinds of decay and other problems that you wouldn't necessarily think you're at risk for otherwise. But the dry mouth complicates things. So yes, we try to take into consideration the entire human being.
Yeah, because infection in your teeth can make you sick all over.
It certainly can. I'm going to talk about that in a minute.
We'll talk about that in our next show.
That's right.
Yeah. Well, any other information you want to share about the TMJ?
Well, I think it might be helpful to let people know that when we make appliances in our office, they're custom made to fit your teeth in a precise manner. And there are over-the-counter or online orders for these sorts of appliances. But one must be careful, because they'll tell you to take your impression, and if you're not really doing it right, you may end up with added fees when it's returned and requested that you do it again. So I suggest to come into our office where we have trained, highly skilled and trained staff to make sure that these impressions are taken correctly to get you an accurate and good fit, something that we can support and guarantee for you in our office.
Well, so they can come into your office. Tell us where you are located.
We are located at 938 West Church Street in Jasper, Suite 104, and our phone number is 706-692-2611.
And, of course, she has the regular Jasper Dental Associates Facebook page.
That's right.
And we also have the Wide Open Facebook page as well, which you can connect to that from the Jasper Dental page or from the WYYZ page.
And please send questions if you're curious about anything that we're not covering.
Yeah, comment in questions. Message them if you'd rather do it that way, and we'll get back to you. We'll have Dr. Sylvia, because I don't know that much about it. We'll have Dr. Sylvia get back to you just as quick as she can, so y'all feel free to go on there and ask any questions you might have. And we appreciate y'all joining us for another episode of Wide Open with Dr. Sylvia Atkinson. And y'all make sure you get on over to Jasper Dental Associates and see what they're all about.